My name is Deborah Brown. I was diagnosed with coronary artery disease and was taken to Paoli Hospital for catheterization, and I had 90% blockage in my left anterior descending artery. I think women really minimize what's wrong with them, and I work for a physician at Paoli Hospital, have for 20 years, and I still did not recognize what was happening to me. I thought I had reflux, and I think that that's the main thing that I've taken away with this, and want women to know that they have to listen to their bodies and really, don't minimize it. I thought if I went to the emergency room, I'd be thought of as a neurotic middle-aged woman having a panic attack. So I put off going for several weeks. It started probably back in the summer where I was just feeling very fatigued. But I had turned 50 the year before. I thought, I'm out of shape. So in August, I joined a gym and started working out. I'd wake up in the middle of the night with chest pressure, but you wake up in the middle of the night with reflux, so I got a pillow to help with my reflux. I had all the testing for reflux, but it continued to get worse. And then I started having the symptoms are classic for women, where nausea, throwing up, and the chest pains were coming fairly frequently. And my daughter, actually, my 19-year-old daughter, finally said, "Mom, you have to go to the emergency room. I'm calling 911." I work right next to Paoli Hospital. And one night I actually left work and sat there, and in my car I had what I call an incident, and looked at the emergency room and said, I really should go. It would pass. I think, I'm fine. But my doctor, Tucci, is the one that told my husband I was probably weeks, possibly days away from a very serious heart attack, which would have probably been fatal in my case. When I got to the emergency room, I had a female nurse and a female doctor, and I don't remember their names at Paoli, but they did not think I was a neurotic middle-aged woman. They took me seriously. They took me right in, did an EKG, which was abnormal. And from that point on, everything was just wonderful. Dr. Tucci's the best. I mean, he's just got these magic hands, and he did the cath the next morning after Dr. Laporte came in and saw the abnormal EKG, and they cathed me and put the stent in, and I'm back to normal.